Hey guys, so we're going to be talking about the acute care environment, and we're going to actually be using a couple different resources today. I'm going to go back to the patient care textbook that you used in 101. They have a lot of information that we're going to look at. Also, in the Score Builders textbook, as well as Physio U. So let's get started. So, ICU is obviously in an acute care environment, but what is an ICU? So it's an intensive care unit, and typically those that are in, as far as a patient, there's the patient might have a lot of different equipment, several different types, and depending on their physiological state. So they might need ventilation to be provided to them, like with oxygen. They might need an intravenous, like an IV therapy. Also might need to have maybe suctions, tubing. A lot of times there's like a suction thing in the back of the wall too. If they, especially with respiratory therapy, they would use that. They may also need different IV lines or arterial monitoring line, which is called an A line, a central venous catheter, urinary catheter. They could have a drainage tube as well. Pulse ox, oxygen. So there's different things too along with that. They might also have like a blood pressure cuff. They might wear all of the time. It'll check periodically. So usually these people, these patients, they need a lot more monitoring when they're in the ICU. And so it's very important to make for sure that you talk to either the patient's caregiver, physician, nursing, and reviewing the medical record, and before you even initiate treatment with the patient. So some patients may be alert while others may be in a coma or they may be unresponsive. And so they're in these specialized care units. They're usually acutely ill or seriously traumatized. So probably one of the biggest thing is, obtaining consent and recognizing what their cognition be. Making sure you ask their name, their date of birth, their location, asking all of those different questions to see about cognitively. And making sure that you allow them enough time to actually answer those questions too. So we're going to go ahead. And so some other things too is they might recover and require less intensive care. Sometimes there's like a step down unit, they call it, a definitive observation unit known as a DOU or telemetry unit. So maybe they have a heart monitor as well. So there's so many different things that they could have as far as lines and tubing. Some other things that you should consider, obviously looking at their medical records going to include like medical history of current illness, prior level of function. Like I said, seeing about their level of alertness, their cognition, if they're sedated, their ability to learn. Trying to see exactly what's their active participation level currently, what they were prior to, looking at the evaluation. Their medical stability, how are their vitals, activity tolerance, I'm sure a lot of these patients are going to fatigue fairly easily with therapy, and adequate proximal muscle strength to participate in active mobility training. So, obviously during the evaluation, they would do a manual muscle testing during the evaluation to see how much muscle strength that they have currently. So we're going to look at this figure, which is, let's see here, page 264 in your patient care textbook, and kind of just highlights as far as like, when a patient is acutely ill, what would be the necessary steps to take. So it'll be necessary to reduce the intensity of the treatment for those, that you might use with less serious ill patients. Typically, these are shorter treatment sessions. There are fewer exercise repetitions, and they usually have a less demand for active participation. So you want to carefully and continue to monitor them and their response to treatment, their observation, and communicating with the patient how they are doing during the session. Need to be aware of constantly monitoring their vital signs, especially if they already have all of the equipment connected to them. So looking at the monitor while they're performing exercises or during your treatment session, if you're doing bed mobility or transfers or gait training. So it's important that you discuss with the patient their current condition, and also, continue communication even during or after treatment to the nurse, patient's physician, and how they performed. because a patient's condition, they can definitely fluctuate from hour to hour, and you might not be able to rely on the information you obtained from the previous visit. So they could decline, they could have a change of status. So make sure that you look over the guidelines and precautions for patients in the ICU, and that's discussed in procedures 10.1 and 10.2. So just talking a little bit more, a lot of times these patients are going to be those that have had a heart attack or a stroke, so myocardial infarction or a CVA. Also, COVID-19 patients, victims of automobile or other accidents, those with head injuries, neurological problems, or even serious infections. So the physician will determine what level of care that will be required. So there's different factors as far as the conditions, the hours of nursing care if needed, and the type of treatments required. So again, make sure you look at those procedures. But, obviously the general overall goal of treatment for patients in the ICU is to minimize or prevent the adverse effects of inactivity and immobility and help the patient become more functionally independent. So, for example, a progression described in 10.3 is if the patient in the ICU. So one aspect of treatment is to prevent the development of contractures through the use of passive and active exercise, proper positioning, and body alignment. In addition to using exercise and physical activity, is important to improve the general condition of the patient. So you can perform bed mobility training if necessary, and develop into transfer and ambulation activities to reach functional independence. Passive range of motion, active range of motion exercises help stimulate the sensory system. Therefore, sensory awareness and coordination may be enhanced through exercise. So looking at the different types of ICU, so make sure you know all the abbreviation for each one of these. PICU could be pediatric or psychiatric. The pediatric ICU, neonatal is in ICU. So NICU, maybe you've heard that before too. So, patients with respiratory deficits or patients who have undergone thoracic or abdominal surgery need to be instructed on how to breathe properly and cough effectively, using their arms or pillow to brace the incision site. So, and that's kind of just a little bit of a side note, but especially for those that have had like open heart surgery, a lot of times they'll use a pillow to brace the incision site. That way it's easier for them to cough. We just talked about all those breathing and coughing techniques, so that would apply to patients like so. So next thing we're going to talk about changing is urinary catheters. So a urinary catheter can be applied internally, that would be an indwelling catheter, or externally. An external urinary catheter is used successfully only in male patients. An internal catheter is a catheter inserted through the urethra and into the bladder. So, these are used to remove urine from the bladder so that it can drain through the plastic tubing into a collection bag, bottle, or urinal. So they can be used for patients who have lost voluntary control of micturition, so just lost the ability to even with bladder function. This might be because they are a spinal cord injury or they've had a surgical procedure. They could have a disease such as MS or physiological changes associated with old age. So any kind of trauma, disease, or condition that can affect the neuromuscular control of the bladder sphincter can be necessary to use a urinary catheter, including before or after some surgical procedures. The catheter can be used temporarily or for a prolonged period of time, even for the remainder of the patient's life. Common complications is obviously infections, probably number one, urinary tract infection or bladder infection. And this is development of the urethral fistula, formation of bladder calculi as a result of urinary stasis and kidney failure. So those that have a spinal cord injury above T6 cord level may experience autonomic hyperreflexuria caused by urine retention. So make for sure that you look over what that means. We've talked about that before, so make for sure you look and see what that means again too. So if the caregiver avoids disruption, disconnection, stretching, or occlusion of the drainage tube, a patient or a catheter can perform exercise of the lower extremities. It should be determined how Much free tubing is available before initiating exercise to avoid causing excessive tension on the tubing. Urine drains into the collection bag because of gravity, so therefore the bag should not be positioned above the level of the bladder for more than just a few minutes. The bag should not be placed in the patient's lap or when he or she is being transported by wheelchair or on the lower abdomen when he or she is lying on a wheeled stretcher. So the bag and tubing should be positioned and secured to minimize the possibility the bag or tubing will be pulled or snagged. And when the patient ambulates, it should be positioned below the level of the bladder and should not interfere with gait or ambulation activities. Some other things too, you should observe the flow and amount of urine in the bag. Any reduced flow or decreased production of urine should be reported to the nurse or physician and PT, especially if there's any kind of observations of abnormal urine appearance, odor, production. Especially if it looks like that there's blood involved with that as well. So anything that looks abnormal should be reported. So a Foley catheter is, indwelling catheter is held in place in the bladder by a small balloon inflated with air, water, or sterile saline solution. Catheter has 2 or 3 tubes and channels in it. The main channel allows the urine to drain, and the other channels are used to inflate the balloon and irrigate the bladder. To remove the catheter, the balloon is deflated and the catheter is withdrawn. So, it's retained by means of a balloon at the tip, which is inflated with 10 milliliters of sterile water. So connected, you can look at page, 609 for score builders and the other catheters that are also mentioned. So a Foley catheter as well, just talking more, I'm sure this is the one that we've seen more so in lab, So many critical ill patients lose the ability to control urination in order to keep the patients dry and to measure amount of urine made. So the Foley catheter is then used. A G-tube, a gastrostomy, which is a procedure to place a feeding tube into the stomach. So the feeding tube is called a gastrostomy tube, or commonly the G-tube. Most commonly used are the PEG and the Mickey button, which we're going to look at that Mickey button here in just a second. So provide nutrition directly into the stomach via a tube through the stomach wall. Unable to take in sufficient calories by mouth, so therefore they need to completely remove the need for food or fluid by mouth. If they have dysphagia, or in some cases to cease oral feeding completely. So a lot of times these patients, they just need maybe because of a procedure, or they might not be able to keep feedings down, especially with speech therapy. Maybe they aspirate. Could be so many different things along with that. So the G tube, though, the plastic tube is directly inserted into the stomach through an incision in the patient's abdomen, so directly to it. So we'll talk about an EG tube in just a second, but this one is directly into the stomach. So the exercises can be performed as long as you are aware of the presence of the G-tube and avoid removing the tube. So you have to make for sure it doesn't get caught on anything as well. The next thing would be a PEG tube. So this is percutaneous endoscopic gastrostomy, a PEG, length of tubing with a valve at the end, which protrudes several inches from the incision area. So here's another picture of what it would look like internally. So one end goes into the stomach, other end a couple of inches long, stays outside the body. The valve is opened at feeding times and food is pumped through the tube directly into the stomach. So I will say anything to do with a feeding tube, a lot of these patients, they have a lot of issues, maybe with bowel movements, might be a lot of irregular, bowel movements. They might have a lot of swelling in their stomach as well and be uncomfortable. So it's good to be aware of that as well. So the Mickey button on the next slide here looks very similar like the small valve that is used to inflate a child's beach ball. It's made of clear, soft plastic and sits right next to the skin, flush to the body. a length of tubing is connected at feeding time. So that's where the tube would just be inserted for feeding times. So just a different time of tubing for that. Now going on to a mechanical ventilator, also known as a respirator. So they use positive pressure to move or propel gas or air into the patient's lungs. So the purpose of a ventilator is to maintain adequate and appropriate air exchange when normal respiration is inhibited or cannot be actively performed by the patient, and can be indicated for diseases or conditions that affects the patient's neurologic or musculoskeletal control of respiration, or that interferes with the exchange of gases in the lungs. So it could be used when the patient experiences apnea or when the potential for respiratory distress or failure exists. So example of respiratory distress that could be developed would be acute respiratory distress syndrome, or ARDS. Similar syndrome affects infants, but it would be potentially life-threatening, and existence must be recognized as soon as it affects the patient. So the immediate steps can be initiated to counteract the syndrome. So some patients, or some possible causes of ARDS are systemic shock, diffuse respiratory infection, and systemic response to sepsis or extensive trauma. Clinical signs and symptoms include dyspnea, tachypnea, cyanosis, and hypoxemia. So must be very careful to treat these patients and monitor their symptoms and their vitals as well. Looking at vital signs and arterial blood gases, and making sure they're within the acceptable ranges for that. So those that they're more likely to be intolerant to active exercise, especially resistive exercise in the early stages of recovery, and complete recovery from ARDS may require several weeks. Syndrome is life-threatening because it can trigger the failure of one or more major organs secondary to the inadequate oxygenation. Therefore, early detection of the syndrome and aggressive treatment are extremely important. So, especially more life-threatening for the elderly, middle-aged elderly, they could actually, this would be very life-threatening for them. So make sure you look at page 609. So some, it doesn't have to be ARDS, but of course there's other serious conditions that someone might be on a mechanical ventilator. So those that have had COVID-19, maybe they cannot breathe on their own, specifically too. They can also use a ventilator, maybe that they don't want them to be in distress as well. So they could be sedated, and so that way maybe they need proper healing or anything like that as well, and not to experience pain. So, anyone that has acute respiratory failure, severe hypoxemia, if they have a worsening respiratory acidosis, so any of these. So goal with the breathing machine is first used to get the patient to be able to breathe on their own, and then it can be removed. So they're at increased risk to develop pneumonia. So typically it depends on the place too, but sometimes before they need a trach, which we'll look at that in just a second, like a trach collar, it just depends. Sometimes, they might be able to get by for 2 weeks before they have to trach them, like a trach tube right into like where the throat would be. So it just depends on the situation, I guess, and so that because they could develop pneumonia as well. So the weaning process, you must be aware that all routine daily ICU activities such as bathing, range of motion, chest physical therapy can increase heart rate, blood pressure, and oxygen. Signs and symptoms of weaning intolerance. So if they're not tolerant to weaning, if they have an increased respiratory rate, especially 35 breaths per minute, decreased tidal volume, significant increased heart rate and rhythm and blood pressure, altered level of consciousness, rapid shallow breathing pattern, or hypoxemia. For someone that's on a ventilator, early exercise and mobilization for physical therapy within 72 hours of the start of mechanical ventilation more than double the rate of independent functional status at discharge compared to those with usual care. So interventions included passive range of motion, especially every morning for unresponsive patients. Then during interruption of sedatives, a physical or occupational therapist can help a patient assist with independent range of motion exercises while supine in bed. As tolerated, exercises can be progressed to sitting up, sitting balance activities, participation in activities of daily living, practicing to sit to stand transfers to a chair or commode, and finally pre-gait exercises and walking. So obviously they don't have to be sedated to be on a ventilator as well. The other thing too, as far as for, for a mechanical ventilator, is that the gas is delivered through, and the tube is referred to as the endotracheal tube, or ETT. When it is in place, the patient is considered to be intubated. So there's a difference. There's also oral pharyngeal, nasal pharyngeal, or oral esophageal, nasal endotracheal, or oral endotracheal airway. Other means of insertion of the tube include a tracheostomy or laryngostomy. That's what I was talking about before, that they call a trach, and kind of in the smaller portion of your neck. The ETT allows suction of the bronchial tree, so a lot of times too there's a different portion to where they can actually put a different tube for suctioning, so that way they don't develop pneumonia too. And so this restricts the patient from talking. So when the ETT is removed, the patient will probably report throat discomfort, voice is likely to be distorted for a short period of time. You must avoid disturbing or accidentally disconnecting the tube of the ventilator from the ETT, or bending, kinking, or occluding connector tube. So be certain that the tube is not obstructed by the weight of the one patient's extremities or trapped on their bed rail. So some other different types of bedside activities include sitting and ambulation. Patient must be informed of the activity. Caregiver must be certain that the tubing is sufficient length to perform physical activity. So since the patient will have difficulty communicating orally, you can ask them to answer questions by head nods or use a notepad and pen. Other nonverbal means, like you could have them just, blink once for yes, or blink two for no, those type of things. Any kind of patient's response to the activity, if there's any kind of undue stress that the patient, should be avoided. They will not tolerate exercise as well as other patients, so you should be cautious during the treatment. Again, vital signs, be alert for any kind of respiratory distress, changes in the respiratory pattern, syncope, or cyanosis. Usually, the ventilator will have an auditory and visual alarm activated by various stimuli, such as if the tube is disconnected, if there's any coughing by the patient, movement of the tube, or change in respiratory pattern or needs of the patient. So a lot of times it'll be alarmed and while you're doing therapy. So some other signs and symptoms of cardiopulmonary distress would be dyspnea, tachycardia, arrhythmia, and hyperventilation. So maybe you have seen a bedside monitor. So these are those, they might be in the ICU and they require special care because of their physiological status. So, include cardiac and vital signs, arterial blood gases, intracranial pressure, pulmonary artery pressure, a central venous pressure, an arterial pressure monitoring line, like an A line. So patients who are being monitored can perform exercise as long as care is not to avoid disruption of the equipment. So a lot of these will still have auditory visual signals, be activated by changes of the patient's condition or function of the equipment, or even patient's position. So, every once in a while it might be necessary for a nurse to evaluate and correct the cause of alarm, almost always. But in other instances, the caregiver can be able to correct the cause safely. So you may cease exercise and allow the patient to rest until the physiological state returns to an acceptable level. You could recognize that the patient's condition can be unstable and should use caution to avoid causing stress for the patient. You want to make sure that you understand which parameters that the various channels of the monitor are measuring or reporting at a given time. And so that way you want to make for sure as well that, their blood pressure, respiratory rate, temperature, blood gases, or cardiac patterns, and that you're aware of what those look like on the monitor and where they're available, and know when things are changing and when to stop exercise. Okay. So, a bedside monitor is, like I've already mentioned all of these as well, but they can have different special functions too. This would be a Holter monitor to measure the rhythm and what that would look like of the heart. An IV pump, so this is the IV infusion. So this is what nursing would be using. And so, but you need to be aware if when it says like the IV is almost complete or the battery is dying and it needs to be charged. So when you're doing therapy and if you're ambulating with someone, you have to be aware of how to unplug it correctly and make sure that it's not dying. There's certain different IV medications that has to be continuous without interruption. So that's why it's always good to ask the nursing if you're allowed to treat the patient at that time. But most usually you can always, take the IV with you. If there's a situation to where maybe you have to change them into normal clothes, you can ask the nurse to disconnect their IV temporarily if they're allowed to, if it doesn't need to be continuous. And then you can reattach it when you're done with therapy. So that's usually pretty helpful too. And then you don't have to deal with the IV at that moment. But if the IV, say, is placed in the brachial portion of the arm, a lot of times it'll alarm. And if you tell the patient to extend their elbow, then it'll stop with alarming as well. Okay. So we've all seen this, but this is just a different one. This would be a sphygmometer, so blood pressure values to treat those in the ICU, but this would usually hooked up to a bedside monitor. Soft restraint, so a material safely fit around the wrist, ankles, or chest, so prevent excessive movement of the patient's body part to which they're attached. So a lot of times when patients are on ventilators and they're confused or maybe they're slightly sedated, a lot of times they do have restraints. So that way they're not pulling out their tubing because it's very uncomfortable and they kind of panic. But obviously they need to be reassessed every hour if they have any kind of restraint. This prevents them from harming themselves as well. So everything I kind of just mentioned. A hemovac is used for efficient postoperative drainage, internal wounds to prevent infection and hematoma. Be used for prolonged suctioning as well. So, I've seen a lot of patients that have had like a total knee replacement and they have like a little, a bulb, which would be just a hemovac. So that way it could, for drainage after surgery, but they could have it in other places as well. Here's another picture of what that would look like. There's different types. An epidural. So just to show you the picture, a spinal, how it would go in all the way to the spinal cord, but then an epidural just goes into the epidural space. So there's two different kinds. So an MD inserts the needle in between the vertebrae and will remove the needle. So a lot of time anesthetic is then administered through the catheter. So, but also, different back procedures, they might go for an epidural as well. So just for pain in general. Colostomy, and this is a surgery created to the opening of the abdomen. Small portion of the colon is brought up to the surface of the skin, so that would be a stoma. So allows the stool to pass directly out of the body, bypassing a diseased or damaged section of the colon. So obviously being aware of this if you have to use a gait belt and make for sure that you are not interrupting this because it would be awful. Here's an actual picture of what that looks like. And so sometimes it does smell pretty bad, and a lot of patients are usually embarrassed by that too, about having a colostomy bag. And it is, pretty, I almost wish they didn't have the bags clear, but it's important to know what the bowel looks like, right? I should have moved this slide earlier, but this is what a tracheostomy would be. So for those that have been on a mechanical ventilator for a short period of time, maybe 2 weeks, might be a little bit longer, and then they have to trach them. So this might be, this is more to where obviously they couldn't wean them from the mechanical ventilator soon enough, so they would still be on a mechanical ventilator, but just not having the mask over their face. So it's intubed and placed directly into the patient's trachea as well. So this is kind of what all those different parts look like. So for those in the ICU requiring long-term mechanical ventilation, or patients unstable to cough effectively to clear secretions. So going back up to this, they'll use a different tube to actually put into here just to suck out all of the different secretions as well. This is what a central line would be. So a central venous pressure catheter. So the CVP catheter is a plastic IV tube used to measure pressures in the right atrium or the superior vena cava. It measures the pressure associated with the filling of the right ventricle. So it'd be the diastolic pressure is what it would be looking at too. So precautions are similar to those mentioned previously for catheters, also applied to CVP line that in place. So complications are similar to pulmonary artery catheter. A arterial line or an A line catheter is inserted into the artery, typically the radial, dorsal, pedal, axillary, brachial, or femoral artery. It's used to continuously measure blood pressure or to obtain blood samples without repeated needle punctures. It is usually provided for accurate measurements. Potential complications include sepsis, hemorrhage, development of fistula or aneurysm, ischemia, or arterial necrosis. Exercise can be performed with an A line in place as long as the precautions described previously are followed, especially precautions related to disruption of the catheter, a disturbance of the inserted needle, occlusion of the line, or disconnection of the line from the inserted cannula. So this is what a central line would look like as well on a patient, and they have different tubings too. So blood from systemic veins flow into the right atrium. The pressure of the right atrium is the central venous pressure. So a PICC line, which is pretty common. So peripherally inserted central catheter for long-term vascular access into a vein inserted through the subvena cava. And it's simple and quick. Usually the procedure, someone has a PICC line, it kind of looks like this, but it could be in different locations. It can be here. It could also be up towards the neck as well. So need to be aware of where this PICC line would be. So this is usually really helpful, so that way they're not having to be sticked and poked and prodded on numerous times. And that way they can just hook up the IV to these places, and then it's a lot easier for the patient too. Swan-Ganz catheter, so make sure you look at that on page 272 in the patient care textbook. So it's a long plastic IV tube inserted into the internal jugular or femoral vein, and it's guided into the basilic and subclavian vein and then passed into the pulmonary artery. Catheter is used to provide accurate and continuous measurements of PAP and detects even subtle changes in the patient's cardiovascular system, including responses to medications, stress, and exercises. This device is indicated when measurements of right arterial pressure, PAP, and pulmonary capillary wedge pressure are desired. Readings are performed frequently. The monitor screen shows a rolling waveform and a digital reading of the various values. So normal values for the right arterial pressure is 2 to 6 millimeters of mercury. And then PAP would be 15 to 30 millimeters of mercury systolic and 8 to 15 millimeters mercury diastolic. And the pulmonary capillary wedge pressure would be 4 to 12 millimeters of mercury, so for normal values. Exercise can be performed with the pulmonary artery catheter in place, but it may be necessary to limit the exercise because of the location of the catheter's insertion. So for example, if the catheter is inserted into the subclavian vein, shoulder flexion should be avoided and other motion should be restricted. So similar restrictions in hip flexion, not greater than 30 degrees, and abduction exists for a femoral vein insertion. Some complications associated with the catheter are pulmonary artery vascular damage, damage to intercardial structures, cardiac dysrhythmias, endocarditis, and sepsis, which would be infection. A traction splint, so a shaft, like for fractures of the femur and fractures of the tibia and fibula. So the surrounding muscles often contract, so pulling the bone ends past each other, causing additional injury, blood loss, pain, muscle, vascular, and nerve damage. So you can look further at that too. A chest tube is a hollow plastic tube placed between the ribs and the chest to drain fluid or air from around the lungs. So this helps to eliminate them having collapsed lung, like a pneumothorax, or alopecia, so hooked up to a suction machine to help with drainage. Occasionally special medicines are given through a chest tube. So I know that you see this child here. This would be the insertion site for the chest tube and port used to drain chest fluid. So anyone that, my dad has had this before, to where he had cirrhosis of the liver and all the fluid was draining into the lungs, and so they had to drain the fluid out through the chest tube so that way he was able to breathe more efficiently. And it's pretty painful for them to get it inserted as well. So make sure you look at page 609 that describes everything for the chest tube. So usually it's used to remove air, blood, purulent matter, or other undesirable material from the patient's chest or pleural cavity. Tubes are inserted through an incision in the chest and may be connected to a mechanical or gravity-based suction system. Usually inserted in different locations depending on the type of drainage desired. So again, they could be placed in the anterior lateral chest wall to promote removal of air, such as treating pneumothorax. So tubes placed inferiorly and posteriorly promote the removal of fluids and blood. And mediastinal tubes can be used to drain blood and fluid necessary to open chest or heart surgery. So precautions would be avoid disruption of the bottles or containers located on the floor, avoid disconnection of or occlusion of the tube, observe the color of the drainage, observe the system for proper function, and monitor the patient's response to exercise or activity. For a patient who ambulates, the can collection bottle should be kept below the level of the location of the inserted tube. So this is kind of what it might look like for how it is into this, what's called a pleural evac. So especially for someone that has drainages, so some diseases such as pneumonia and cancer can cause an excess amount of fluid or blood to build up in the space around the lungs, which would be a pleural effusion. Some severe injuries to the chest wall can cause bleeding around the lungs, again, pneumothorax or gravity dependent. So this would measure the fluid. NG tube is next, so kind of bouncing around, but this is on page 607. So another feeding tubes, but this is through the nasal. The nasogastric tube is a clear plastic tube inserted through the nose. So again, the other one was a G tube where it was directly to the stomach. This one's going through the nasal, through the esophagus and into the duodenum or duodenum. Tube can be used initially to remove air and digestive juices from the stomach. It is also used as a feeding tube for the comatose patient. Tube is uncomfortable but not painful. So a lot of patients complain about this as well, just being uncomfortable. So usually they have an NG tube if they're not able to eat food or drink fluids through the mouth, and that way the NG tube is in place. Exercise can be performed with the NG tube in place, but movement in the patient's head and neck should be avoided, especially flexion or forward bending. So that's on page 607. On page 608, and make sure you look at other monitoring devices and on score builders, but this would be a ventriculostomy. So it looks really painful, doesn't it? So the ICP monitor, this is what the intracranial pressure monitor would be in place, and pressure exerted against the skull by brain tissue, blood, or cerebrospinal fluid, CSF. So used for patients who have experienced a closed head injury, cerebral hemorrhage, or brain tumor, or overproduction of cerebrospinal fluid. So normal pressure is 4 to 15 milliliters of mercury, but it can fluctuate to 20 milliliters of mercury as a result of a variety of routine activities as well. So complications of this device include sepsis, hemorrhage, and seizures. So the following types of ICP monitoring devices are used: a ventricular catheter, subarachnoid screw, and epidural sensor. So make sure you look at each one of those. Limited physical activities can be performed with these devices in place. Activities that cause a rapid increase of ICP, such as isometric exercise and Valsalva maneuvers, should be avoided. Patients should be positioned to avoid neck flexion, hip flexion greater than 90 degrees, and lying in prone position. Patient's head should not be lowered more than 15 degrees below horizontal. As with all the other devices we talked about that use a plastic tube, you must be careful to not avoid disrupting it, disconnecting, or occlusion of the tube. Oxygen delivery, so normal is 95 to 98%. Below 90% needs supplemental oxygen, but obviously we don't make that decision. Nursing, physician, respiratory, but you would need to alert them on that. So this is usually delivered via nasal cannula or the mask. So we're going to look at each one of these, but page 608 on Score Builder. So this would be a nasal cannula used for patients needing only low flow supplemental oxygen, and those with breathing difficulties such as emphysema, pulmonary pathologies require nasal cannula. The flow rate for a cannula is around 0.5 to 4 liters per minute of oxygen. Simple face mask. So the flow rate for the simple face mask is between 4 to 8 liters of per minute of oxygen. So a non-breather mask is attached to the simple face mask as well, but obviously there's a bag. So traumatic injuries or cardiac related illnesses employs a large reservoir that fills with the patient is exhaling. So these holes are sealed while the patient is inhaling, and patient is breathing pure oxygen. Flow rate is 10 to 15 liters per minute. This is an oxygen concentrator device used to provide oxygen to a patient, substantially higher concentration than use of ambient air. So one or two things. So obviously this could be connected to the wall of the hospital and it's continuous concentrator. This one would be more for at-home use, and they would have to use it all the time instead of using if they didn't want to do oxygen tanks. So make sure you review all of that information as well. Some other things too, just random things. If there's a prayer cloth, don't throw it away. So in the Bible in Acts 19, 11, 12, it speaks of how cloths, aprons, and handkerchiefs were touched to Peter and Paul and taken back to the sick who were often cured of their illnesses. So don't ever throw a prayer cloth away. Be aware of what military time would be, 24 hours in a day. So each ones are numbered 1 through 24. So, 1 o'clock in the afternoon is 13 hours. 1:15 in the afternoon is 13:15. So patient information board, very important to keep up with. Obviously there will be other things besides just walking, usually what level of assistance they are. So it might be rowing walker, min assist times 1 times 100 feet. Anything like that might be on here as well, or anything to be aware of. Okay, so now I'm jumping into the other PowerPoint slide as well. So this would be, trying to line it up. The acute care environment. So a lot of these are going to be, information from your Score Builders textbook. So you can follow along with me on that. All right. So I'm going to be looking at all these different kinds of tests that are mentioned. An ultrasound or ultrasonography. So is a non-invasive procedure to visualize soft tissue structures. So high frequency sound waves are reflected back to the transducer, producing structural image. There's a Doppler effect as well, so for scans, and so make sure you look at the definition on page 613. So there's also endoscopy. So invasive procedure that provides direct visualization of internal body structures by means of a lighted lens system. So this would be located on page 475 of your Score Builder. So make sure you read over what that looks like. This is what that would look like and positioned. There's two different types as well, or there's several different types, but you can do tube, or they could swallow a pill that has like a camera with it as well. So radiography would be like, or radiography would be like X-rays, so short wavelength electromagnetic vibrations are absorbed. So if it's more dense, it's more white. If it's air-filled, then it's black. You can use contrast as well. So it produces a 2D image in grayscale, and so you can look at that on page 613. Here's an example of an X-ray. Next one would be a bone scan. Make sure you read over that information on page 610. That's what that would look like. So what a bone scan is for. Fluoroscopy, continuous stream of X-rays, direct viewing of the image with a fluorescent screen. So look over this information as well as on page 611. This is kind of what that looks like as far as imaging. Angiography involves injection of contrast medium to the vasculature to allow radiographic examination, so to detect aneurysms, thrombosis, any kind of occlusion of susceptible vessels. So this is kind of what it would look like here too. So make sure you look over that information, score builders. Computed tomography, or CT scan, it's also known as computed axial tomography, a CAT scan, combines X-ray beams and computer-based calculations to determine different absorption patterns in soft tissue, providing minor differences in tissue densities. It's displayed in cross-section or slices, so internal organs, bone, soft tissue, or blood vessels. So again, score builders page 611. And this is what it would look like. So again, sliced, this is like of the brain, sliced images all the way down. An MRI, or magnetic resonance imaging. So make sure you look over the definition for this one as well, page 611 to 612. So, things that aren't seen on an x-ray, but looking at more of like soft tissue structures, meniscus, they'd be able to determine, if there's a meniscus tear or ACL or PCL or MCL, more so than, an x-ray is more so just bone more than anything. So looking at more soft tissue structures, especially like if, like obviously up here, like a spinal cord injury and compression, you'd be able to see that more so. Nuclear medicine imaging, such as a PET scan. So this could be used to, maybe determine like cancer, but they can also look at for organs function in the body. So look over that information as well. This is what this would look like, nuclear medicine imaging. So it's pretty cool. This was PET with a CT scan in combination. Electrodiagnostic, evasive test of diagnosis, treatment of supraventricular or ventricular dysrhythmias and syncope. So measures cardiac electrical conduction system activity. So review those information as well. And electroencephalogram, I'm going to show you a picture in just a second, but also located in your Score Builders textbook. So this is to see indication for epilepsy, seizure activity, any kind of focal brain abnormalities, such as Parkinson's and Alzheimer's. So this is kind of what this looks like here. Nerve conduction velocity test, you'll probably hear that a lot. So measuring the speed of electrical impulse through the nerve to see if there's any kind of nerve damage. It could be for nerve pathology or muscle pathology, used to diagnose Guillain-Barré syndrome, carpal tunnel syndrome, and peripheral neuropathy. So arterial blood gases, so make sure that you review all this information. All of this should be reviewed from PTA 160. As well as this would be all reviews. So make sure you review all that information. So I know that's pretty short and sweet and to the point, but a lot of it is definition based. So make for sure that you're reviewing all that information in your patient care, O'Sullivan, and Score Builders textbook. Thank you all. Have a wonderful day. Well, before you click off, I completely forgot that I also want you to go on to PhysioU. So I'm going to go ahead and scroll on over here and make for sure you go to the lines and tubes. And under each one of these tabs, I want you to make for sure that you're looking under each one of them and what their definitions are for these and what that looks like. Okay. Let's see. So there's different masks associated, kind of gives you different pictures of itchy tube, some things that we've already talked about, what a wound vac would look like too, and how that would be positioned. So depending on where it's at. So usually, even this is where the wound vac would be. I think there might be two going on right here. Let's see, some other things too. Obviously you've seen a blood pressure, pulse ox. I'm sure you've seen maybe an ice machine before, IV, what a PICU line would look. So make sure you look at over each one of these. This PCA pump, they can be used patient-controlled analgesia. So pain medicine pump as well. Might be morphine, might be other kind to where the patient every so many minutes, sometimes it's 10 to 15 minutes, and then they can click a button to receive more medication. Just have to be really careful with that too, and as far as communication, making sure they're not having too much pain medicine. So this is an example: chest tube, closed suction drain with bulb. So so here's the bulb. That's pretty common, that you'll definitely probably see in therapy. It could be to the knee, it could be to the abdomen, any kind of drainage tube after surgery. This would be a CPAP machine, external urinary catheter, a Foley catheter, and what that would look like. Hemovac, that's the STOMI, like so colonoscopy bag as well. Let's see, peg tube, PureWick. So this is a newer thing too, so make sure you know what a PureWick looks like. Not newer, but so these are used for those that are in place of doing like a urinary catheter, and they're kind of hard to position and to make for sure it absorbs, usually for females more than anything. And then this whole blue thing can be disconnected and thrown away every so often. This is what the suction, so it would be into, be suctioned and then into a one of these containers as well, is where it would be located at. So making for sure that it's in place, and so that way that there's not urine everywhere too. Let's see. There's also a rectal tube that you can look at here. So this would be a continuous nerve block. So this would be like a femoral nerve block, and what that would look like and how it would be in place with, they're using an ultrasound to be really precise of where that would go to. This would be like a CPM machine. So continuous passive motion. So you'll definitely probably be maybe setting one of these up. Now they're not as used as what they once were, but you can look at different evidence-based research that supports it. These are used, to improve circulation. So a lot of times you would be taking these on and off of a patient. So especially for someone that just had surgery or someone that's going to be in bed for a prolonged period of time, it has a pressure, and it can be like a compression. So that way it decreases the risk of DVTs. Okay, I think that is all that is really located on there. Let me see. Yep. Also want you to look at some different case studies, like for the physical therapist assistant, and what that would look like too. So make for sure you review all that information as well. All right. Thank you all. Have a wonderful day.